Good morning everyone. Myself Shweta Naik, Assistant Professor of Home Science, Government Home Science College, Narsipura. Today I am going to deal about session number 7, that is concept of prenatal development. In that you are going to learn about conception, pregnancy signs and symptoms, complication and discomforts. So let us move further. So let us know what is the conception. It is the first step of the in human development. We can say it's a first step for the development. Here what happens to single cell from male, one from male and one from female, joined together it forms zygote. This set of motion is very powerful and genetic forces that will influence the individual over the lifespan. Here, human fertilization means a union of egg and sperm, usually occurring in the ampulla of the uterine tube. This result of the union is the production of zygote or a fertilized egg, initially prenatal development. So, human fertilization anta andre one cell from ಫಿಮೇಲ್ ಆ್ಯಂಡ್ ಒನ್ ಸೆಲ್ ಫ್ರಮ್ ಮೇಲ್. ಸೊ ಫಿಮೇಲ್ ಸೆಲ್ಲಿಗೆ ಎಗ್ ಅಂತ ಕರಿತೀವಿ, ಮೇಲ್ ಸೆಲ್ಲಿಗೆ ಸ್ಪರ್ಮ್ ಅಂತ ಕರಿತೀವಿ. ಸೊ ಇದು ಆ್ಯಂಫುಲ್ ಆಫ್ ದ ಯುಟರೈನ್ ಟ್ಯೂಬಲ್ಲಿ ಯೂನಿಯನ್ ಆಗಿಬಿಟ್ಟು ಅದು ಝೈಗೋಟ್ ಆಗಿ ಕನ್ವರ್ಟ್ ಆಗುತ್ತೆ. ಇದನ್ನು ನಾವು ಫರ್ಟಿಲೈಸ್ಡ್ ಎಗ್ ಅಂತಲೂ ಕರಿತೀವಿ. ದಿಸ್ ಈಸ್ ದ ಫಸ್ಟ್ ಇನಿಷಿಯಲ್ ಸ್ಟೆಪ್ ಇನ್ ದ ಪ್ರಿನೇಟಲ್ ಡೆವಲಪ್ಮೆಂಟ್. ಇಲ್ಲಿ ನೀವು ನೋಡಬಹುದು. ಸೊ ದಿಸ್ ಈಸ್ ದ ಓವರಾಲ್ ಯುಟರಸ್. ಈ ರೀತಿ ಇರುತ್ತೆ. ರೈಟಿಗೆ ಒಂದು ಓವರಿ, ಇದು ವಾಲ್ನಟ್ ಸೈಜ್. ರೈಟಿಗೆ ಒಂದು ಓವರಿ, ಲೆಫ್ಟಿಗೆ ಒಂದು ಓವರಿ ಇರುತ್ತೆ. ಸೊ ಎವ್ರಿ 28 ಡೇಸ್ ಆಫ್ ಮೆನ್ಸ್ಟ್ರಲ್ ಸೈಕಲ್ ಒನ್ ಓವಮ್ ಬರ್ಸ್ಟ್ ಫ್ರಮ್ ದಿಸ್ ಓವರಿ, ಜಸ್ಟ್ ಲೈಕ್ ದಿಸ್. ವೆನ್ ಇದಕ್ಕೆ ಈ ಪ್ರೊಸೆಸ್ಸಿಗೆ ನಾವು ಓವ್ಯುಲೇಷನ್ ಅಂತ ಕರಿತೀವಿ. ಸೊ ವೆನ್ ಓಮ್ ಬರ್ಸ್ಟ್ ಫ್ರಮ್ ದ ಓವರಿ ಆ್ಯಂಡ್ ಟ್ರಾವೆಲ್ ಥ್ರೂ ದ ಫೆಲೋಪಿಯನ್ ಟ್ಯೂಬ್. ಸೊ ದಿಸ್ ಈಸ್ ಕಾಲ್ಡ್ ಆಸ್ ಅ ಓವ್ಯುಲೇಷನ್. ಸೊ ಈ ಎಗ್ ಏನು ಮಾಡುತ್ತೆ, ಫಾಲೋಪಿಯನ್ ಟ್ಯೂಬ್ ಮುಖಾಂತರ ಚಲಿಸುತ್ತಾ ಹೋಗುತ್ತೆ. ಒಂದು ವೇಳೆ ಫಿಸಿಕಲ್ ಇಂಟರ್ಕೋರ್ಸ್ ಆದರೆ ಸ್ಪರ್ಮ್ ಬಂದು ಎಗ್ಗಿಗೆ ಯೂನಿಯನ್ ಆದವಾಗ ಇದಕ್ಕೆ ನಾವು ಫರ್ಟಿಲೈಸ್ಡ್ ಎಗ್ ಅಥವಾ ಝೈಗೋಟ್ ಅಂತ ಕರಿತೀವಿ. ನೆಕ್ಸ್ಟ್ ಅದೇನಾಗುತ್ತೆ, ಸೆಲ್ ಡಿವಿಷನ್ ಸ್ಟಾರ್ಟ್ ಆಗುತ್ತೆ. ಅದು ಫಸ್ಟ್ ಸಿಂಗಲ್ ಸೆಲ್ ಆಗುತ್ತೆ, ನೆಕ್ಸ್ಟ್ ಡಬಲ್ ಸೆಲ್ ಆಗುತ್ತೆ, ನೆಕ್ಸ್ಟ್ 4, ನೆಕ್ಸ್ಟ್ 8, ನೆಕ್ಸ್ಟ್ 16 ಆಗಿಬಿಟ್ಟು ಲಾಸ್ಟಿಗೆ ಬ್ಲಾಸ್ಟೋಸೈಟ್ ಆಗುತ್ತೆ. ಈ ಬ್ಲಾಸ್ಟೋಸೈಟ್ ಮತ್ತೆ ಟ್ರಾವೆಲ್ ಮಾಡಿ ಹೈಪೋಬ್ಲಾಸ್ಟ್ ಆದವಾಗ ಬಂದು ಯುಟರಸ್ ವಾಲಿಗೆ ಅಟ್ಯಾಚ್ ಆಗುತ್ತೆ. ಸೊ ದಿಸ್ ಈಸ್ ವಾಟ್ ಹ್ಯಾಪನ್ಸ್ ಇನ್ ದ ಪ್ರಿನೇಟಲ್ ಪೀರಿಯಡ್ ಫಾರ್ ಫಸ್ಟ್ 2 weeks. Okay. So as I said, a process of conception is nothing but about once in every 28 days, in the middle of the women menstrual cycle, one ovum burst from her one of her ovary. Ovary means 2 walnut sized organ located deep inside in her ovum, and is drawn one of 2 fallopian tubes, long thin structure that lead to hollow soft lined uterus. While the ovum is traveling, the spot on the ovary from which it is released, now it's called as a ಕಾರ್ಪಸ್ ಲೂಟೈಮ್. ಅಂದರೆ ಈ ಓವರಿ ಬರ್ಸ್ಟ್ ಆಗೋ ಮುಂದೆ ಅದೇನು ರಿಲೀಸ್ ಆಗಿರುತ್ತಲ್ಲ, ಆ ರಿಲೀಸ್ ಆಗಿರೋದನ್ನ ಈಗ ಕಾರ್ಪಸ್ ಲೂಟೈಮ್ ಅಂತ ಕರಿತೀವಿ. ಇದೇನು ಮಾಡುತ್ತೆ, ಇದು ಹಾರ್ಮೋನನ್ನು ಸೀಕ್ರೆಟ್ ಮಾಡುತ್ತೆ. ಸೊ ದಟ್ ಅದು ಯೂಟ್ರಸ್ಸಲ್ಲಿ ಏನು ಮಾರ್ಪಾಟಾಗುತ್ತೆ ಅಂದರೆ ಥಿನ್ ಲೈನಿಂಗ್ ಆಫ್ ಬ್ಲಡ್ ಫಾರ್ ಅ ಪ್ರಿಪೇರ್ ಆಫ್ ದ ಫರ್ಟಿಲೈಸ್ಡ್, ಅಂದರೆ ಎಗ್ ಫರ್ಟಿಲೈಸ್ ಆಗಲಿಕ್ಕೆ ಪ್ರಿಪೇರ್ ಮಾಡುತ್ತೆ. If pregnancy does not occur, corpus luteum shrinks and the lining of the uterus is discarded 2 weeks later with the menstruation. ಸೊ ಒಂದು ವೇಳೆ ಪ್ರೆಗ್ನೆನ್ಸಿ ಅಥವಾ ಕನ್ಸೀವ್ ಆಗಲಿಲ್ಲ ಅಂತಂದರೆ ಈ ಕಾರ್ಪಸ್ ಲುಟಮ್ ಏನಾಗುತ್ತೆ, ಶ್ರಿಂಕ್ ಆಗಿಬಿಟ್ಟು ಅಂದರೆ ಒಣಗಿಬಿಟ್ಟು ಬ್ರೇಕ್ ಡೌನ್ ಆಗಿಬಿಟ್ಟಾವಾಗ ಅದು ಮೆನ್ಸ್ಟ್ರೇಷನ್ ಆಗಿ ಅಂದರೆ ಬ್ಲಡ್ ಆಗಿಬಿಟ್ಟು ಹೊರಗಡೆ ಬರುತ್ತೆ. ಆ ಮೇಲ್ ಪ್ರೊಡ್ಯೂಸ್ ಸ್ಪರ್ಮ್ ಇನ್ ಎ ವಾಸ್ಟ್ ನಂಬರ್ ಆ್ಯನ್ ಆ್ಯಾವ್ರೇಜ್ ಆಫ್ 300 million per day. ಒಬ್ಬ ಮೇಲು ಸ್ಪರ್ಮನ್ನು ಒಂದು ಡೇಗೆ 300 million per day ಹೊರಗೆ ಹಾಕ್ತಾರೆ. In the final process of maturation, each sperm develops a tail that permits to swim long distance. upstream in the female reproductive tract through the cervix opening of the uterus and into a fallopian tube where fertilization usually take place. The journey is difficult and many sperm die. Only 300 to 500 reach the ovum if one happens to be present. So male sperm every day 300 million ರಿಲೀಸ್ ಆಗೋದು ಏನಾಗುತ್ತೆ ವೆನ್ when that physical intercourse happens, when the sperm enter into the female reproductive organ with the help of opening of the uterus, it will travel in the fallopian tube with the help of the tail. ಸೊ ಈ ಜರ್ನಿಯಲ್ಲಿ ಏನಾಗುತ್ತೆ ಸುಮಾರು ಸ್ಪರ್ಮ್ಗಳು ಸಾಯುತ್ತೆ. ಓನ್ಲಿ ಓವಮ್ನ ರೀಚ್ ಆಗೋಷ್ಟೊತ್ತಿಗೆ 300 to 500 ಸ್ಪರ್ಮ್ಸ್ ಮಾತ್ರ ರಿಟೈನ್ ಆಗಿರುತ್ತೆ. ಸೊ ಸ್ಪರ್ಮ್ ಲೈವ್ ಫಾರ್ up to 6 days and can lie in wait for a ovum, which survives only 1 day after being released into fallopian tube. However, most conceptions result from the intercourse during the 3rd day of period on the day of ovulation or during the 2nd day preceding it. With the conception, the story of the prenatal begins to unfold. ಸೊ ಈ ಸ್ಪರ್ಮ್ 6 ಡೇಸ್ವರೆಗೂ ಅದು ಜೀವಂತವಾಗಿರುತ್ತೆ. ಎಲ್ಲಿ ಫ್ಯಾಲೋಪಿಯನ್ ಟ್ಯೂಬಲ್ಲಿ ಅದು ಓಮ್ಗೆ ವೆಯ್ಟ್ ಮಾಡ್ತಾ ಇರುತ್ತೆ. ಆದರೆ ಓಮಿಂದು ಲೈಫ್ ಸ್ಪ್ಯಾನ್ ಬರೀ 1 ದಿನ ಇರುತ್ತೆ. ಅದು 1 ದಿನ ಆದಮೇಲೆ ಆ ಓಮು ಸತ್ಬಿಡುತ್ತೆ. ಸೊ ಹಾಗಾಗ್ಬಿಟ್ಟು ಎವ್ರಿ ಇಂಟರ್ಕೋರ್ಸ್ ಆಗಿ ಎವ್ರಿ 3rd ಡೇ ಆಫ್ ದ ಪೀರಿಯಡ್ ಓವುಲೇಷನ್ ಆಗುತ್ತೆ. ಸೊ ಈ ಓವುಲೇಷನ್ ಆದಮೇಲೆ ಒಂದು ವೇಳೆ ಸ್ಪರ್ಮ್ ಓವನ್ 2 ಯುನೈಟ್ ಆಗಿ ಝೈಗೋಟ್ ಫಾರ್ಮ್ ಆಯಿತು ಅಂತಂದರೆ ಅಲ್ಲಿಂದ ಪ್ರೀನೇಟಲು ಶುರುವಾಗುತ್ತೆ. ಆನ್ ಆ್ಯಾವ್ರೇಜ್ ಫರ್ಟಿಲೈಸೇಷನ್ ಹ್ಯಾಪನ್ಸ್ ಅಬೌಟ್ 2 weeks after your last menstrual period. When the sperm penetrate the egg, changes occur in the protein coating of the egg to prevent other sperm from entering. At the moment of fertilization, your baby genetic makeup is complete, including its sex. The gender of your baby depends on what sperm fertilize the egg at the moment of conception. So, ಎಗ್ ಯಾವಾಗ ಸ್ಪರ್ಮು ಎಗ್ನ ಎಂಟರ್ ಆಗುತ್ತೆ ಆವಾಗ ಅದು ಒಂದು ಪ್ರೋಟೀನ್ ಲೇಯರನ್ನು ಮತ್ತು ಎಗ್ ಸುತ್ತಲೂ ಕವರ್ ಮಾಡುತ್ತೆ. ಸೊ ದಟ್ ಬೇರೆ ಸ್ಪರ್ಮ್ ಬಂದು ಎಂಟರ್ ಆಗಬಾರ್ದು ಅಂತ. ಆಮೇಲೆ ಅಟ್ ದ ಮೂಮೆಂಟ್ ಆಫ್ ಫರ್ಟಿಲೈಸೇಷನ್ ಓನ್ಲಿ ಆ ಬೇಬಿದು ಜೆನೆಟಿಕ್ ಮೇಕಪ್ ಏನಿರುತ್ತೆ ಅನ್ನೋದನ್ನು ಅದು ಸ್ಪರ್ಮು ಡಿಸೈಡ್ ಮಾಡಿಕೊಂಡೇ ಬಂದಿರುತ್ತೆ. ಅಂದರೆ ಇಫ್ ದ ಈಗ ಜನರಲಿ ಫಾರ್ ಎಗ್ ಕಂಟೆಂಟ್ಸ್ XX chromosome and sperm may contain XX, either XX or X5 chromosome. Generally, women have genetic combination of XX and men have XY. As the mother, you provide each egg with an X and each sperm can provide either X or a Y. ಸೊ ಎಂಟರ್ ಆಗುವಂಥ ಸ್ಪರ್ಮು ಐದರ್ X ಇರುತ್ತೆ ಅಥವಾ Y ಇರುತ್ತೆ. ಸೊ ಅಟ್ ದ ಟೈಮ್ ಆಫ್ ಫರ್ಟಿಲೈಸೇಷನ್ ದ ಕಾಂಬಿನೇಷನ್ ಆಫ್ XY result a baby and the combination of XX result the girl. Here some common signs of pregnancy are quoted. The primary sign of pregnancy is the missing of menstrual period or a 2 or more consecutive periods. But many women experience other symptoms of the pregnancy before they miss period. Missing period does not always mean that woman is pregnant. Menstrual irregularities are common nowadays. It may cause due to the control pills, conditions such as diabetic or polycystic ovary syndrome or eating disorder or certain medication. Women who miss the period should see their healthcare provider to find out whether she is pregnant or not. The pregnancy symptoms vary from women to women. A woman may experience very common symptoms, but some women may feel none of the symptoms. General signs are slight bleeding. Slight bleeding means 25% of the women experience slight bleeding or a spot that is lighter in the color than the normal menstrual blood. This is typically occur when the time of implantation, the fertilized egg about 6 to 12 days after conception, but it is common in the first 12 weeks of the pregnancy. Another symptoms is tender or swollen breast or nipples. Women may notice this symptom as early as 1 to 2 weeks after the conception. Hormonal changes may can make breast sore or even tingly. The breast feel fuller or heaviest as well. Next symptom is headache. The sudden rise of hormones may trigger headache early in pregnancy. Next symptom is fatigue. Many women feel more tired early in pregnancy because their bodies are producing more of a hormone called progesterone, which helps maintain the pregnancy and encourage the growth of milk producing glands in the breast. In addition to that, during pregnancy, the body pumps more blood to carry nutrients to the fetus. The pregnant women may notice fatigue as early as 1 week after conception. So, fatigue is normally observed in all. Nausea or vomiting. This symptom can start anywhere from the 2 to 8 weeks of the conception and it can continue throughout the pregnancy. Commonly, it's referred as a morning sickness and it can be actually occur at any time during the day. Another one is food craving or aversion. Sudden craving or developing a dislike of favorite foods are both common throughout the pregnancy. After a food craving or aversion can the last entire the pregnancy throughout this period. This vomiting as well as food craving. It will last for the pregnancy duration. Another symptom is mood swing. The hormonal changes during pregnancy often cause sharp mood swings. This can occur as early as few weeks after conception and uh, it will throughout up to the pregnancy. Next is frequent urination. The need to empty the bladder for often time throughout the pregnancy. In the first few weeks of the pregnancy, body produces hormone called human chronic gonadotropin, which increases blood flow to the pelvic region, causing women have to urinate more oftenly. This is the reason why the women get more frequent urination. Next, common complications of pregnancy. One is high blood pressure. High blood pressure is also called as a hypertension. It occurs when arteries carrying blood from the heart to the body organs are narrowed. This causes pressure to increase in the arteries. In pregnancy, this can make it hard for blood to reach the placenta, which provides nutrients and oxygen to the fetus. To reduce the blood flow can slow the growth of the fetus and place the mother at the greater risk of preterm labor and preeclampsia. So ಹೈಪರ್ಟೆನ್ಷನ್ ಅಂದರೆ ಹೈ ಬ್ಲಡ್ ಪ್ರೆಷರ್ ಅಂತ ಕರಿತೀವಿ. ಇದು ಯಾವಾಗ ಆಗುತ್ತೆ ಅಂತಂದರೆ ಯಾವಾಗ ಆರ್ಟರೀಸ್ ಬ್ಲಡ್ಡನ್ನು ಹಾರ್ಟ್ ಮುಖಾಂತರ ಆರ್ಗನ್ನಿಗೆ ರೀಚ್ ಮಾಡಬೇಕು. ಆವಾಗ ಅಲ್ಲಿ ಅದು ಅನೇಬಲ್ ಆದವಾಗ ಅಥವಾ ಫ್ಲೋ ಫೋರ್ಸು ಕಡಿಮೆ ಆದವಾಗ ಇದು ಶುರು ಆಗುತ್ತೆ. ಸೊ ಇಲ್ಲಿ ಪ್ರೆಗ್ನೆನ್ಸಿಯಲ್ಲಿ ಏನಾಗುತ್ತೆ ಅಂತಂದರೆ ಬ್ಲಡ್ಡು ಪ್ಲಾಸೆಂಟನ್ನು ರೀಚ್ ಆಗುತ್ತೆ. ಸೊ ಪ್ಲಾಸೆಂಟಾದಿಂದ ಮಗುವಿಗೆ ನ್ಯೂಟ್ರಿಷನ್ ಮತ್ತು ಆಕ್ಸಿಜನ್ ಸಿಗ್ತಾ ಇರುತ್ತೆ. ಸೊ ಅಲ್ಲಿ ಏನಾಗ್ಬಿಡುತ್ತೆ, ಬ್ಲಡ್ ಫ್ಲೋ ಕಡಿಮೆ ಆದ ತಕ್ಷಣ ಅಲ್ಲಿ ಫೀಟಸ್ ಗ್ರೋತು ಹ್ಯಾಂಪರ್ ಆಗ್ಬೋದು. ಜೊತೆಗೆ ಮದರಿಗೂ ಇದು ತುಂಬ ರಿಸ್ಕ್ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತೆ. Women who have high blood pressure before they get pregnant will continue to have to monitor and control it because medication if it's necessary, then she have to go through it, because high blood pressure develop in a pregnancy, it will retain for further or it may vanish. If the blood pressure develops in pregnancy, this is called as a gestational hypertension, and typically gestational hypertension occurs during the second half of the pregnancy and goes away after the delivery. Just like gestational hypertension, gestational diabetes also occur. Where the women did not have a diabetes before the pregnancy, they can have a condition during the pregnancy. Along with this, some of the infection, including sexually transmitted infection, may occur during the pregnancy or at the time of delivery. When the pregnant woman, after her delivery, baby travel through the birth canal. At that time, infant may get the infection. Preeclampsia. Preeclampsia is a serious medical condition that leads to preterm delivery and the death. Its cause is unknown, but some women are not at a increased risk. So, next risk factor include first pregnancies, preeclampsia in the previous pregnancy, existing conditions such as high blood pressure, diabetes, kidney disease, and the systematic. These are being the 35 year of age or older, carrying 2 or more fetuses, and obesity. These are all the risks included in the duration of pregnancy. Next, stillbirth. Stillbirth means loss of pregnancy after the 20th week of the pregnancy. This is called as a stillbirth. So, ಅಂದರೆ 20ನೇ ವಾರಕ್ಕಿಂತ ಮುಂಚೆ ಆ ತಾಯಿ ತನ್ನ ಮಗುವನ್ನು ಕಳ್ಕೊಂಡ್ಲು ಅಂದರೆ ಅದಕ್ಕೆ ಸ್ಟಿಲ್ಬರ್ತ್ ಅಂತ ಕರಿತೀವಿ. ಸೊ ಈ ಕೇಸಸ್ಗಳು ಯಾಕೆ ಆಗ್ತವೆ ಅಂತ ಅಂದರೆ, ಇಟ್ಸ್ ಮೇ ಬಿ ಡ್ಯೂ ಟು maybe the chromosomal abnormalities, placental problems, or poor fetal growth, chronic health issues, and the infections. Pregnancy loss ಅಥವಾ miscarriage ಅಂತ ಅಂದರೆ when because of the natural reasons before the 20 weeks, if the miscarriage happens, ಅದಕ್ಕೆ ನಾವು ಅಥವಾ she may lose her pregnancy, ಅದಕ್ಕೆ ನಾವು miscarriage ಅಥವಾ pregnancy loss ಅಂತ ಕರಿತೀವಿ. Signs are vaginal spot, bleeding, cramping ಅಥವಾ ಫ್ಲೂಯಿಡ್ ಸೀಕ್ರೆಟ್ ಆಗೋದು ಅಥವಾ ಟಿಶ್ಯೂ passing from vagina. However, bleeding from the vagina does not mean that miscarriage will happen or it's happening. Women experience this sign at any point of the pregnancy. So, at that time, she should contact her doctor. Common discomforts during the pregnancy. The common discomforts are nausea or vomiting, dizziness, and fatigue. And hemorrhoids. Hemorrhoids are nothing but because of the pressure, increased pressure, the perineum or a rectum, increased blood volume, and the increased likelihood of the becoming constipated as the pregnancy process. Hemorrhoids are common in late pregnancy. Varicose vein means swollen veins or purple veins. They can observe on the pregnant ladies. Then heartburn, indigestion, head attack, headaches, constipation, backaches. Then bleeding gums, pica, swelling, and fluid retention. Skin changes, stretch marks, and congested or bloody nose. Yeast infection due to hormonal changes and increased vaginal discharge, also called cardia. So these are all the common discomfort. So ಇಲ್ಲಿ ಏನಾಗುತ್ತೆ, heartburn and indigestion ಅಂದರೆ ಗ್ಯಾಸ್ಟ್ರಿಕ್, and the headaches, constipation ಅಥವಾ ಬ್ಯಾಕ್ ಪೇನ್ ಇದೆಲ್ಲ ಗೊತ್ತು. ಸೊ ಇಲ್ಲಿ swelling in the foot and the hand we can observe. Pica means bike. Then you can observe skin changes, stretch marks on the abdomen, and some female experience the bloody nose and the yeast infection due to the hormonal changes increased in the vaginal discharge. So this is called as a leukorrhea. So these are about the concept of prenatal development, pregnancy signs, symptoms, complication, and discomforts. Thank you.